Hi there, and welcome to another pathophysiology video. So Easy here, and today we're going to have a little look at menopause. And before we get started, let's find out what you already know. So question 1, what is the average age a female goes through menopause? Is it 14, 51, 82 or 25? Feel free to pause this video and take a moment to think about the answer. And the answer is 51. This is thought to be the average age a female may go through menopause. Question 2. Which hormone is markedly reduced in menopause? Is it estradiol, FSH, LH or thyroxine? And the answer is A. You'll see a reduction in estradiol as well as an increase in FSH levels due to the negative feedback. And finally, what is the greatest cause of premature ovarian failure? Is it genetic, iatrogenic, autoimmune, or idiopathic? And the answer is D. It's thought the majority of cases are idiopathic. Don't worry if you didn't know the answers to these questions, because we're going to go through them again at the end of the video. So, we're going to have a little look at what menopause is, some of the symptoms, the pathophysiology and some of the causes, and a history and clinical tests you want to think about in menopause. And then finally, we're going to revisit those questions at the end. So, what is menopause? It's defined as when you have no menstruation for 12 months. The average age that this tends to occur is around 51. And you'll tend to see a reduction in primary ovarian follicles significantly by the age of 40 and over. Along with this, you'll have a permanent change in the hormone profile. So if you can see in the graph in the top right, you'll have a marked reduction in estradiol after menopause. But along with that, you'll also have a huge increase in FSH, and this is trying to compensate through negative feedback loops in order to try and stimulate more estradiol production. So some of the symptoms of menopause, obviously reduced estradiol can cause a variety of symptoms. Commonly you'll hear about vasomotor symptoms, so menopausal women will be complaining of things like hot flushes and night sweats. You can also get acute clinical manifestations, so things like changes in the menstrual pattern, any mood swings, difficulty concentrating, headaches. There's medium-term symptoms, so things like vaginal dryness or painful sex, reduced libido, any sort of thinning of the skin or any hair loss, and long-term health implications, so increased incidence of osteoporosis, cardiovascular disease, stroke, and increase in body weight. So the pathophysiology of menopause. So the number of primary ovarian follicles decrease markedly after the age of 40. And this then leads to a decrease in estradiol and hence an increase in FSH due to the negative feedback loop in the hypothalamic pituitary gonadal axis, indicated on the right. We try to stimulate more estradiol from the remaining follicles, and estradiol is released more rapidly, therefore resulting in shorter menstrual cycles. And this sort of continues until the depletion of the primary ovarian follicles. So causes of menopause. So physiological cause is aging, so it's naturally occurring in women. But there's also pathological causes of menopause. So, premature ovarian failure. This is defined as women under the age of 40 with more than 4 months of no periods and 2 recordings of FSH levels which are greater than 30 international units per milliliter, taken at least 1 month apart. And the majority of cases tend to be idiopathic. Now, this is achieved through 2 mechanisms, either through the dysfunction of follicular maturation or depletion in the follicular pool. So, in terms of a history or clinical tests for menopause, in the history you want to think about the age of the patient, the symptoms that the patient is presenting with, and whether this is physiological or pathophysiological. In terms of clinical tests, you might want to do a blood test to measure the FSH levels and see whether these are above 40. Normally you wouldn't use estradiol levels because these tend to fluctuate after menopause and it wouldn't be a reliable test. And that's it. So let's have a look at those questions again. What is the average age a female goes through menopause? 14, 51, 82 or 25? And the answer is 51. So this is the average age a female may go through menopause. Which hormone is markedly reduced in menopause? Estradiol, FSH, LH or thyroxine? And the answer is estradiol. Remember, this comes with an increase in FSH levels due to the negative feedback loop in the hypothalamic pituitary gonadal axis. And finally, what is the greatest cause of premature ovarian failure? Genetic, iatrogenic, autoimmune or idiopathic? And the answer is D. The majority of cases tend to be idiopathic. And that concludes this pathophysiology video on menopause. Thanks very much for checking it out, and I hope it was useful. Take care now.